My name is Barbara McKeon, and I am a nurse injector, registered nurse, and I'm also an esthetician. So I do a variety of things here, but primarily I specialize in facial injections and laser treatments. All the dermal fillers, Juvederm, Restylane, Perlane, Radiesse, and there are others that can be used. We also do sculpture here, but the doctors do those injections. A typical profile is usually someone who's in a highly competitive field, real estate, acting, where unfortunately, our society is such that a lot of the time the first impression you make has to do a lot with how you look, and that is age-related, obviously. Well, if it's just fine lines, I really believe in starting with the simple and proceeding to the complex. So you may start with things like hydrofacials and topical treatments, antioxidants and anti-aging, and see how that goes. You would maybe do that for 3 months, and sometimes that's sufficient to really make a good improvement for a patient. And then if it doesn't, then you go to the next step, which would be injectables like Botox or Dysport or dermal fillers. Well, actually they're the same active ingredient, but they are formulated differently, so they behave a little differently. And if you are truly allergic to cow's milk, you should not use Dysport, because even though these products are highly purified, if anything were to get through that purification system, which is very doubtful, it's the protein that you would have a reaction to, and Dysport, there may be cow's milk protein in there. We've just recently acquired this new laser called the EndyMed, and it is a skin tightening procedure which would help fine lines and wrinkles, and it is also a body contouring procedure, but it does not involve liposuction. It is just radio frequency, where you are heating deep into the dermis, and from what we can see of the things that we have done so far, it promises to be a good result. But you do have to do more than one treatment, probably a month apart or 2 weeks apart, whatever it is you're doing.